When we look at age of patient and the progressive nature of scoliosis, there's two key things to understand. As curves get bigger, they're more likely to progress, and that is by far the biggest influence on how likely a curve is to progress during critical times. And second thing is that the most critical times is during pubescent growth spurts and later stage life, somewhere around 45 or 50 plus. The bigger the curve is going into these stages, the more likely the curve will continue to progress. In adolescent growth spurts, we know if curves are less than 25 degrees going to the adolescent growth spurt, there's a 33% chance the curve will progress to surgical before they're done growing. Once you break 25 degrees but less than 45 degrees, the number doubles. Now it becomes a 66% chance that it will progress. And then of course, once you break 45 and it's considered severe scoliosis, there's a 96% chance the curve will progress every single time you grow. So the goal should be keeping curves below 25 degrees as much as possible, because the percentage of progression during growth spurts is much less. In the adult stage, we know an average 50-degree curve progresses 1 degree per year of life, half a degree to 1 degree, but smaller curves progress less, bigger curves progress faster. So again, in the adult stage, it's the best interest of the patient is to keep the curve as small as possible. With these two facts, you think the goal of every single treatment option is to keep the curve as small as possible. However, traditional treatment options tend to do nothing until curves hit severe standard stages and their recommended surgery, where our approach is much different, much more proactive. We want to treat curves as much smaller sizes to prevent curves from ever hitting these categories where more invasive treatment is recommended.